Hello, everybody, and welcome to the Funders Together webinar on connecting health and housing through innovative solutions. I'm Lauren Bennett. I'm the Communications Manager here at Funders Together, and I just really want to thank you for taking the time to join us today. Today's webinar is going to focus on unique and effective ways that funders are addressing the intersection of health and housing stability that's happening across the country. And we're also going to look at how to work across sectors to make this happen. Just a few housekeeping items before we get started. As of now, all participants are on mute, and everyone will remain on mute throughout the presentation. If you do have a question during the presentation, you can type it into the question box, which is on your webinar panel on the right-hand side of your screen. The question box looks like this. You can enter a question at any time, but I will save all the content-related questions for the end of the presentation after our panelists have gone. And finally, since I know this will be asked, the presentation is being recorded, and yes, we will share it with you. Because we want this to be a space for candid discussion amongst our funders, we will only make this available to Funders Together members on the webinar recordings page on our website. You'll have to log in to view the recording. And if you have any issues doing so, go ahead and contact me. My email address is lauren@funderstogether.org. And now I'd like to go ahead and introduce today's panelists. We have Jean Freeman Crawford. Jean joined Missouri Foundation for Health in 2010 as a health policy officer and became a program officer in 2011. She previously worked at the Jefferson County Health Department coordinating a methamphetamine prevention program that focused on substance abuse, prevention, interagency collaboration, and advocacy. She began her career at Legal Services of Eastern Missouri and worked as a social worker at St. Patrick's Center assisting individuals who are experiencing homelessness. We also have Nancy Sasaki. Nancy is the Executive Director of Alliance Healthcare Foundation. She's held this position since August of 2011. And prior to joining the foundation, she was the Executive VP of Planned Parenthood of the Pacific Southwest from 2004 to 2011. Her career with Planned Parenthood spanned 30 years, beginning as a health educator in Austin, Texas, and included the CEO in Los Angeles and the interim CEO in Hawaii. We're really excited to have them both on board today, and they have a lot of great information for y'all. So Nancy, I'll go ahead and I'll turn it over to you.
All right, thank you so much. Welcome everybody. I'm excited to share with you some of our path and some of the work that we've been doing in this intersection between health and housing. And it really started for me when we were looking at our 4 target populations. 2 of them are very broad, and then also the children and homelessness. And the homeless area, I started getting involved in that area and trying to keep it kind of like into what we focus on, which is health and wellness, and just wanting to look at just the health part of it. And yet every conversation I was in really led back to housing. And so, you know, it's unavoidable in a lot of ways if you want to try to get at the health impacts of homelessness. So if you want to go to the next slide. One of the things that I think was the most impactful statement that I heard was that people who live on the street have a lifespan that is 25 years shorter than those who don't. So just right off the bat, in order to impact health, if you can get them off the streets, you've already increased their lifespan. That doesn't mean that the work is done, that's for sure. As we've looked at our target populations and those that are experiencing homelessness, as I'm sure many of you on this call also understand, is that there are many complexities to somebody who ends up finding themselves on the street and finding themselves homeless, and many needs that they have to address. Next slide. It always brings me back to Maslow's theory of need, and that is that first and foremost it's psychological and safety, and that you have to feel like you're in a safe environment. You have to know where food is coming from, where water is coming from. You have to feel like you have the security of a house and the safety of a place to live. And you can't begin to think about the mental health. You can't begin to think about how to prepare them for a job. You can't think about how to prepare them for taking care of themselves and hygiene when they live on the street. But until you get them in the house, you can't even begin to address their health needs. Those needs of food, water, and safety are only addressed through housing. So housing is the first step to ensuring the improvement of someone's health. That led me to get involved with our grantmaker organization, San Diego Grantmakers, and sit in on the conversations around the homeless. We had a working group that was looking at the issues that are happening around homelessness. And like I said, I started into this work in 2011. This group had been meeting long before that just to learn about homelessness. And through the evolution of the work that we were doing together, you finally get to a place where you can learn all you want and you can't do anything until you actually do something. So if you could go to the next slide. Our Funders Together to End Homelessness San Diego chapter formed a few years ago, probably about 3 years ago now, from this working group, and decided that we would adopt the goals and the guidelines of Funders Together to End Homelessness as we move forward in our work in San Diego. We were a mighty group of about 5 local funders who were interested in pooling their money together in order to make a difference in our community. So the first year that we started, we had about $800,000 to distribute, and we wanted to look at how we could make an impact on systems change in our community. This was also about the time that HUD was requiring an expansion of the governing board, that was requiring communities to figure out how to do community assessments, and right in the beginning of that. So we found that with our dollars, we could actually catalyze as well as influence the direction that our community moved. We were able to give money to set up our, back then called our Coordinated Assessment and Housing Placement program. We gave them the money to set up that database. We were also in conversations about what tool to use to actually do these assessments. And we had a homegrown, really local kind of assessment tool that everybody really seemed to like, especially the providers, because it pretty much transitioned everybody to transitional housing. But we decided that we would give money to this group to do their work if and only if they adopted the VI-SPDAT. We felt like that was critical in our ability to understand how we were progressing, as well as how we compared to other communities, by having a standard set of data, standard set of questions that we could compare ourselves to. So we as Funders Together were able to put this money to really good use. And if you go to the next slide, unfortunately you can't read this very well, which I didn't notice until too late. It's a little better than I thought. But this is the matrix from which we work every year. We review this and update it on an annual basis. We look at the funds that have been pledged by the people that are in the group, and we set our priorities and we set the funding allocation. So you'll see that the first one is systems change. This has evolved over the past 3 years. I think this is our 4th matrix. But it has evolved because we were really putting in a lot of money to beef up and shore up our Regional Continuum of Care Council, as well as our Regional Task Force for the Homeless, and doing a lot of database building. So that was actually separate. But now that we're much more kind of in the groove of everything that needs to happen, it's now part of our systems change effort. But that still includes data enhancement. We're still looking at how we can do this work and understand what the data set tells us. We're looking at what provider education and training is needed. And you can see by up there in terms of what else we're funding. And we funded this to the tune of about $300,000 and have started to allocate some of that money so that there's no money remaining currently. We've also started looking at families and children and youth homelessness, wanting to get ahead of the curve in terms of what we can do in our community. We've allocated some money there as well, and we hosted a youth summit in order to prepare the community to look at the last HUD funding allocations for youth homelessness. We also recognize that our community is undergoing a lot of change, and we don't know exactly where dollars will need to be spent. And so we have money allocated in our emerging opportunities. And we were able to pair up and partner with the county in order to support one of the efforts that they had applied for to get some funding. We were able to expand that by $100,000 in this particular category. We also have hired a director that is our face in the community. This was after, like I said, about 3 or 4 years that we were able to actually allocate some funds to hire a director instead of us as volunteers trying to do all of the work. And we still also have quite a few dollars that are unallocated, again, looking at what is happening in the community and where we might allocate those funds. So if you want to go to the next slide. I'm going to jump ahead now to our innovation initiative. At Alliance Healthcare Foundation, back in 2010, we decided that we wanted to put some money out there that could be directed at systems change. At that time, the Affordable Care Act was coming down the pike, and we were hearing from our community that they weren't prepared, that it was going to be they were going to be inundated, they needed providers, they needed capacity. Excuse me. And we said, well, here's $1 million to tell us what you would do if you could change healthcare for the underserved. We've had some very interesting proposals come before us in this innovation initiative, and probably the one that we funded last year is the most relevant to the work that we're doing. But we funded things like an ingestible sensor so that you could tell whether or not a person was taking their medication. This has been really important in the treatment of tuberculosis, because what you want to be able to do is ensure that they're taking their medication and also impact the public health by reducing risk. Right now, what they have to do is come into the health department and actually have them observe them take their medication. So during the time that they're on their medications, they're completely tethered to San Diego. They can't leave. So this allows them to travel anywhere they so desire, and they swallow their medication. The ingestible sensor sends a signal to their stomach, sends a patch on their stomach, sends a signal to their cell phone and to the doctor's office so they know that they've taken their medication. Saves a lot of money, saves a lot of resources, and the nurse doesn't have to go out and try to find the person someplace in San Diego County. So in each year, we announce our innovation initiative launch. We invite proposals, and we pick about 5 proposals to come before the board. And during the time that they're selected and the time that they present, they have about 6 weeks to work with business consultants that we've hired to help them prepare their business plan and their business presentation. So last year, we selected Interfaith Community Services. If you'll skip to the next slide. Interfaith Community Services is located in North County, and many times North County is kind of overlooked in the scheme of things because there's so much activity and so much work that's being done in San Diego, the city of, that many times other areas feel a little bit shortchanged. So we were excited to be able to fund this proposal from the Interfaith Community Services. They provide a variety of and a range of services from recuperative care to shelters and housing. They do food distribution, they do job training, and they do a lot of the wraparound services that the people that they're serving are in need of. The proposal that came to us was to look at the fact that when somebody's homeless and they're ready to get into housing, so they're ready to get into services, when they walk in the door, when they have the courage to walk in the door, one of the first questions they're asked is, how long have you been sober? And many times it's last night or a few hours ago, and they're considered not eligible for services until they've been sober for at least 24 hours. Some organizations have a 72-hour waiting period. Well, you probably know what happens. They go back out to the streets and they're self-medicating again. So Interfaith Community Services came to us and said, we'd like to set up a detox and a sobering and detox center that feeds into our recuperative care, center. If you'll go to the next slide. So I'm a little bit ahead of myself. So in the recuperative care, in their services, what they wanted to do is be able to provide a place where the police could bring people that they've picked up from the streets, not take them to jail, but bring them to their sobering center. We know that that could be a kind of a revolving door in a lot of ways, but eventually by seeing the same people, the hope is that they would then want to get into medical detox. They will partner with one of the community clinics in order to provide the medical detox to the clients that want to get sober, they would then be able to document the length of time that this person has been sober, either refer them to other sites based on the services they need, or keep them in-house and provide the services themselves. So we were really excited about this. We thought this would be a great opportunity. They had been looking at some property, felt like they had a place that they really liked. They had two stumbling blocks. One was going to be political, and one was going to be just in terms of construction, whether or not they would actually fit. The politics of it all was that in this particular city, maybe I should keep them anonymous since they're a little bit blurred as well, they felt like they were already doing enough. They had several providers that were providing services to the homeless. They were the center of the jail in the North County area. They had people that were being brought there from other cities and remaining homeless in their location, and we were telling them that's because once they sober up, they're released to the streets. They're not released back to the city that they came from, and that's why your homeless population is partly one of the reasons why your homeless population is growing. This would actually help to keep them off the streets, would help them actually go through the detox, would help them actually get housing and then not be back on your streets. But politically, it was going to be quite a hurdle. It also turned out that the location that they were looking to work with had some construction issues that were going to make it wildly exorbitant in terms of the cost. So between the politics and the cost of this particular location, they were not able to secure this site for their facility. So then we were on the search. Next slide, please. We found this great place called Green Oaks Ranch, already doing some detox services for the homeless. They had a very specific niche of the homeless that they were working with, but they had a lot of property, and they were willing to work with this with Interfaith Community Services in order to build on their site the detox and sobering center that they wanted, as well as to provide some housing as well. So this sounded like a great opportunity, and it's going to take 2 years to go through the planning process and the building process. So it's not really a short-term fix in terms of finding a facility. What happened next was really quite interesting, because in the recuperative care site, they had been having a contract with the VA to provide beds for those that needed recuperative care services. The VA had actually contracted for the beds, but only paid for them when somebody was in them. Some of their other beds that they had contracted with some of the other hospitals, they were actually paying, like renting the beds, whether they were occupied or not. So it provided a great revenue stream. But then when they needed them, they were there available for them, and they could put people into those beds for recuperative care services. And if you go to the next slide, you'll see the site where they are actually doing their recuperative care, which as the program, as you can see, the program is offering housing, meals, transportation, medication management, case management, mental health, all of the services, all of the wraparound services. And yet they had these beds that weren't being utilized. So when all of this started happening and the VA got some cuts, and they had to give up some of their beds, they went to the city of Escondido and were able to get zoning approval to put this wellness center, that excuse me, what they're calling their wellness center for the sobering and the detox, into this current site. So there's no building expense there. A little bit in terms of some restructuring, hiring some staff, and they're pretty much ready to go. So as we've been trying to work around all of this, they were approved last year, and here we are still looking for a facility. It looks like we have one. In their recuperative care facility, they have a 70% success rate in housing individuals that go through their program. So we're excited to be able to do this work with them and to be able to get this started, get this off the ground, continue to work with the Green Oaks folks and figure out how we can start building on that particular property and make that also a reality, and then look at how they can expand the pilot once they're able to show that they are successful in this endeavor here at the Hawthorne Veteran and Family Resource Center in Escondido. I believe that's all of my slides.
Thank you so much, Nancy. We really appreciate the information that you shared. This is Jean Freeman Crawford, and as Lauren indicated earlier, I am a program officer at Missouri Foundation for Health. And Lauren, go ahead and change to the next slide. I've been at the foundation about 7.5 years now, and I'm really excited today to talk with you about our Show Me Healthy Housing program. I'll actually begin with a brief introduction to Missouri Foundation for Health in order to provide some context for the development of our Show Me Healthy Housing program. Next slide, please. The Missouri Foundation for Health is an independent philanthropic foundation. We were created in 2000 following Blue Cross Blue Shield of Missouri's conversion from nonprofit to for-profit status. Our foundation's mission surrounds improving the health and well-being of individuals and communities most in need. And we strive to be a resource for the region, working with communities and nonprofits to generate and accelerate positive changes in health. Next slide, please, Lauren. So we generate that change through work in our service region, which is approximately 3/4 of the state of Missouri. And it actually mirrors Blue Cross Blue Shield of Missouri's service area. So it consists of 84 counties as well as the city of St. Louis. Next slide. The Missouri Foundation for Health, we really try to take a multifaceted approach to health issues, really understanding that programs, policy, and collaboration all play a role in creating lasting impact. For most of our grant-making history, our programmatic funding actually focused on direct healthcare services and health education and promotion versus social factors that impact health. And you can see on your slide there a few examples of our past work surrounding specific health issues. Next slide, please. So our most recent strategic plan enacted in 2013 focused on these specific areas that you see here, on preventing childhood obesity, increasing health insurance coverage, and reducing infant mortality. So all three of these areas have very specific goals and objectives, and were considered part of our targeted areas, if you will. Next slide, please, Lauren. But our strategic plan also included a more flexible funding area, the responsive area, if you will, it was known at that time, which was really open to address pressing health needs in our communities. And our overall strategic plan actually certainly provided some structure to the responsive area, but there were also some areas yet to be developed, which actually and ultimately created an opportunity for the foundation's first investment in housing. Next slide. And go ahead, Lauren, again. Thank you. So now we'll dive into our Show Me Healthy Housing program. So a few years ago, in the spring of 2014, Missouri Foundation for Health board members asked staff to really look into the relationship between health and housing to determine what type of an impact a potential one-time investment could have in that field. So of course, after that request, our staff members talked to many different stakeholders all throughout the country and conducted a great deal of research. We actually spoke with a number of other foundations who have funded in housing or really looking at more of healthy and active communities. We spoke with the Kresge Foundation, MacArthur Foundation, Conrad Hilton Foundation, and did a lot of other research into what other foundations are doing, but we also spoke with a number of different local nonprofit agencies and agencies throughout our service area. So whether they were homeless service providers, housing authorities, we also spoke with federally qualified health centers, banks. We also talked with the Missouri Department of Mental Health, their housing division, and Missouri Housing Development Commission, our state housing finance agency. So we are greatly appreciative of all of the stakeholders who spoke with us and really helped inform our knowledge of health and housing. So after a few months of research in this area, we brought forth an idea for the pilot Show Me Healthy Housing program in July of 2014. And at that time, our board of directors approved a $3 million investment. Go ahead, Lauren. So we really centered on permanent supportive housing as a cornerstone of Show Me Healthy Housing. We found in our research, of course, that permanent supportive housing combines affordable housing with social and healthcare services designed to assist individuals and families most in need. We felt that there was really a great deal of evidence around permanent supportive housing and how it does, in fact, improve the health of tenants living there. And staff felt that since permanent supportive housing really focuses on those most in need, so that could be individuals who've been homeless, even chronically homeless, individuals with a severe mental illness and or chronic health condition, that it really fit within our mission of helping those most in need. And so individuals, could really utilize stable housing as a platform for health and for and recovery. So our objectives of the pilot program included increasing access to permanent supportive housing in the service area by funding permanent supportive housing, supporting collaborations, and then evaluating the impact. Go ahead, Lauren. So these are the 4 components of our Show Me Healthy Housing program. So we initiated a pilot grant program, which I'll speak to shortly, Missouri Supportive Housing Institute, Show Me Healthy Housing Loan Fund, as well as a program evaluation. Go ahead, Lauren. So we began in the fall of 2014 with our Show Me Healthy Housing pilot grant funding program, where we provided nearly $1.1 million in grants for gap financing to 4 nonprofit agencies in our service area. All of these agencies received or were applying for low-income housing tax credits and received funding from other sources, but still had a gap, if you will, in their funding needed for their permanent supportive housing projects. So Missouri Foundation for Health was able to close that gap with our funding. And we found that our investment of $1.1 million in grants actually leveraged nearly $17.7 million in other financing. And through the work of our 4 housing grantees, a total of 111 new apartments were built, and those were all affordable housing apartments, with 50 of those apartments being those set aside for individuals eligible for supportive housing. Go ahead, Lauren. So initially in 2015, we had just had the grant funding cycle, of course, the previous few months prior, and we were really interested in what could we do to accomplish our goal of improving health and really trying to strengthen those existing collaborations in this field. And so we partnered with CSH. They were previously known as Corporation for Supportive Housing. Now they go by CSH. And we began and launched the first Missouri Supportive Housing Institute. And initially that institute just had 4 teams, but actually we just finished another institute in 2017 this past summer, and the number of teams that were participated grew to 7 teams. And this is really looking at strengthening permanent supportive housing applications, and it's where essentially the teams, which consist of property manager, a developer, and a social service provider. They meet 2 to 3 days per month over a series of over 4 months, and they learn essentially about how to develop permanent supportive housing, how to manage it, and of course all of the ins and outs of the permanent supportive housing. And it's just a really wonderful capacity building experience, and we found that 2 of the 4 teams initially in 2015 who participated, they actually received then low-income housing tax credits using, of course, the project that they had worked on during the Institute. So basically, by the end of the Institute, you have a specific project that you can then apply to, receive funding for, or apply to for funding. Okay, next slide. So then we really did a lot of research into other ways of financing housing, or other ways of being able to support or increase rather the availability of permanent supportive housing. So after our initial grant making round in 2014, we spoke with other funders, including Andrea at the Conrad Hilton Foundation, about other models of increasing the availability of supportive housing. And we actually found that program-related investments, or PRIs as they're known, are a way for foundations to leverage their funding through lending. And so loans, loan guarantees, and even equity investments can be made by foundations to support a charitable purpose. And these different financial vehicles actually offer foundations alternatives beyond traditional grant making to have an impact, particularly in housing. And so certainly foundations who wish to use PRIs must meet requirements issued and set by the IRS, but there's definitely, it's a possibility for many foundations. And we found that there was really a nice benefit to utilizing a PRI, and that you have the potential to raise a larger pool of funds than with grants, and because investors, and so you can all essentially loan the fund, the money rather, and then you can get that money back, especially because we utilized the money for the loan fund is for pre-development financing. So there are certainly some different options with the PRIs, but we chose to utilize what they call the externally managed PRI. We actually issued a request for proposals, or RFP, to be able to get some different bids, if you will, from different entities who could manage this loan fund for us. And we selected CSH as the loan fund manager. And so they combined the loan that they received from the Missouri Foundation for Health of $1.5 million to their statewide their national loan pool, and then actually created a statewide lending resource of $4.5 million. And so, we are restricted, Missouri Foundation for Health, funding in our service area. And so there are many other counties, of course, Kansas City area, Springfield, Springfield is in our service area, but Kansas City is, of course, a big urban center, and we cannot fund anything, in there. But then by combining this loan pool of money with ours, it was able to make it statewide, which was really exciting. So we believe that this loan fund and the Housing Institute really help build capacity in the supportive housing field in our service area, since nonprofits learn how to develop and manage supportive housing at the Institute, and then can obtain financing for the initial cost of the project from the loan fund. So we believe that pre-development financing is really a critical need, especially for those nonprofits who never previously built supportive housing. Okay, Lauren, next slide, please. So it was really important to us to really try to measure the impact of our housing. And so we actually focused really on the work of our 4 initial grantees, and trying to measure how permanent supportive housing improves health. So we actually issued a request for qualifications to be able to get proposals from evaluators throughout the country who hopefully have had experience in working in permanent supportive housing, or evaluating, working with nonprofits or entities in that field, because we really wanted to be able to have expertise, as somebody with expertise as our evaluator. So we chose the Urban Institute as our evaluator and partnered with them now. It will be 3 years. We're just beginning, or in the middle of our 2nd year right now. And they, last year, they actually issued this report here that's featured on this slide, the first year 1 report, if you will. And they found that Missouri Foundation for Health grants, of course, they ranged from $24,000 to $500,000 to those 4 housing grantees, and they were relatively small compared to the overall project cost. But they found they were instrumental in leveraging other funding streams, particularly the highly competitive 9% low-income housing tax credits necessary to develop supportive housing. They also found that their programs are serving tenants with multiple barriers to permanent housing who would likely have struggled to find housing elsewhere. So more than half of the adult tenants, 55%, had been chronically homeless before entering housing. 91% reported a mental illness, 67% reported a chronic health condition, and 36% were in fair or poor health. And so generally, they also showed that the grantees were following best practices and adopting the housing first principles of reducing barriers to program entry and practicing harm reduction in providing voluntary services. They also indicated that many tenants felt that a huge barrier had been lifted for them by being housed. Many expressed that the home was the nicest in which they had ever lived, and for some, it was actually the first time that they had ever had homes of their own. So another key finding from evaluation was that one of our grantees actually did not develop permanent supportive housing as we had indicated or as we had thought in the application process, but instead developed transitional housing. And so certainly while the housing was sorely needed and it was very important to tenants living there, it actually didn't have a permanent subsidy associated with those units. So the tenants, after a certain period of time, I think it was 18 months, would have to secure other housing or be able to be moved to another program if other vouchers were available to have a permanent subsidy. So this was actually a really interesting finding. It's something that I was very shocked by, quite honestly, and it's a lesson learned for us in this process. So the Urban Institute is really focused on, again, looking at the permanent supportive housing and whether it's improving health. So, with, of course, the consent of the tenants, they're actually tracking health claims data from Medicaid as well as from the VA, if, of course, a tenant is a veteran. And they're really looking at what type of services, healthcare services, tenants are accessing now compared to what they accessed earlier. And so that, of course, normally in many cases, some individuals who are homeless may feel the need to go to the ER more often than individuals who are housed because they're in a more stable environment and have access to more preventative care options. So that's something that they're looking at. They're also looking at, whether or not individuals may have been incarcerated before they were housed, and then how kind of that history is affected by being housed. So they're looking at a number of different ways, in addition to data and information from the HMIS data, or Homeless Management Information Systems, and trying to also see kind of the history of homelessness. So of course, many of tenants who live in housing have been chronically homeless, as I mentioned earlier. So really trying to measure the impact of the housing, the supportive housing, on their lives. Okay, next slide, please, Lauren. So one of the really big pieces of our Show Me Healthy Housing program is that we really try to collaborate and bring key partners together. So as I mentioned earlier, Missouri Foundation for Health has essentially 84 counties in the city of St. Louis in its service area, and we recognize that housing needs really exist throughout, of course, the country, but in the entire state of Missouri. So our first Housing Institute was actually limited to those teams, nonprofits who were located in our service area. And so we really wanted to be able to have this Housing Institute be statewide, and actually received requests back in 2015 to make that happen. And so we partnered with the Healthcare Foundation of Greater Kansas City and also the Missouri Department of Mental Health, their housing division, to enable our 2017 Missouri Supportive Housing Institute to be statewide. And we were very excited, as I indicated earlier, to have 7 teams participate this year, and all 7 teams then have a good idea of the PEV projects, what they would like to pursue pending upcoming funding opportunities. So it was really wonderful to be able to partner with those organizations and also to learn from them, and just really as very much a collaborative environment. And so I think, really it's all, with regards to bringing key partners together, it's also very helpful to show, that you have this commitment to permanent supportive housing, and to explain why. That was something that, we, of course, didn't have to explain to Missouri Department of Mental Health, but some other, potential funders or other foundations who may, like Missouri Foundation for Health was, be new to that space. This was actually the first capacity building opportunity that Healthcare Foundation of Greater Kansas City supported, with regards to housing. So it was really exciting, to have their participation, and we're very grateful to them. Okay, next slide, please, Lauren. Okay, so really, in conclusion, I always like to talk about lessons learned, and there are a number of lessons learned from our experience with Show Me Healthy Housing. It's just been such a wonderful experience, and meeting folks who work in the field and how passionate individuals are. And we of course learned a lot from different decisions that we made. And I would say, if anyone is considering investing in housing, would definitely recommend that you allow enough time to really get to know the key players in the field, understand the landscape, and have a sound knowledge of the subject matter. We really had about 3 months of time to get to know the field, to be able to learn who was funding in that space. And so I don't feel like that was really enough time to be able to be as comfortable as I would have liked. And I have to say, I always like to share the story that we knew we were in unfamiliar territory when one of the invited applicants to our original Show Me Healthy Housing funding our grant program asked us about using a sources and uses development budget instead of our standard budget documents. I had no idea what sources and uses was. I had to look it up. And so that was kind of very humbling, realizing that there's a lot, of course, that you won't know because, we're not housing developers. But it was a, just really interesting experience. And then knowing who else is funding in this space locally, there was actually a separate group of housing funders meeting at the same time in St. Louis that we weren't initially fully aware of. And I think there could have been an even greater opportunity to leverage funding and impact if we had known about, that group a little bit earlier. And then legal aspects. So, what happens if you provide funding for the housing, supportive housing, but it doesn't get developed? What if the housing isn't truly supportive housing? That's also something, like I mentioned earlier, that we've encountered. And housing, is really an amazing and also complicated field. I always like to say to expect the unexpected, like project sites changing. We had one of our grantees who thought they were going to have a certain site, and it actually got bought before they were able to secure everything needed, and so they had to really regroup, and we then extended, their grant in order to allow them more time to secure a new site. So we've really learned an incredible amount about housing and health over the past 3 years. Certainly look forward to learning more from the upcoming evaluation reports at the end of this year and next year. And I really appreciate your time today and the interest of Funders Together to End Homelessness and sharing information about health and housing. And Lauren, if you go to the next slide, there is my contact information. Feel free to give me a call or send me an email. I always enjoy talking about housing. It's just a wonderful area, and I'll be happy to answer any questions that you might have. So thank you so much, and Lauren, I'll turn it back to you.
Thank you so much, Jean and Nancy. That was a lot of awesome information, and I'm sure we're going to have quite a few questions, which leads us to our next session. So we will go ahead and open it up to questions. And as I mentioned earlier, if you do have a question for our panelists, you can go ahead and enter it into the questions box on the right-hand side of your screen. But as we wait for questions to come in, I did want to let you know about some additional networking and learning opportunities that we have coming up this fall, if you can believe that fall starts tomorrow. So next week, we will be hosting our first small call and open dialogue with our CEO, Amanda Anderi, and also USICH around making progress on ending family homelessness. And if you're interested in that, you can go ahead and register for this on our website under our programming section, just like you did for this webinar. We also will be hosting our first in-person convening for our new Community of Practice Foundations for Employment and Housing, and that's going to be October 18th and 19th in Washington, D.C., along with our partners, Heartland Alliance. And we also are starting another Community of Practice for United Ways who are interested in connecting with other United Ways and going deeper into learning about homelessness and intersecting issues. So if you are interested in either one of those Community of Practices, you can go ahead and email Jennifer Olney, and her email address is jennifer@funderstogether.org. So we'll go ahead and open it up to some Q&As here. So first of all, and I think that a lot of people have this question as non-health funders, what do you think, and this is open to both you, Nancy and Jean, what do you think is the best way to approach a health funder to collaborate on housing stability issues?
Nancy, did you want to start that, or?
No, I think that's a great question, and it so often really depends on each of the foundations and how they approach the health issues in general. I think that to get people interested in it, if homelessness or serving the homeless are not necessarily their target population, I think piecing out some of the health issues that have to be addressed in the wraparound services is a place that you can get funders interested in that are interested in solely in health funding. I think it's in that work and really getting involved in knowing what's going on in the community that allows funders to kind of broaden their perspective and see how they can have a bigger impact with slightly more dollars, but a bigger impact that has a lasting effect when you start looking at that intersection of health and housing.
I think that's a really good suggestion, and I would say that it was actually the supportive services, the healthcare services that I think really helped convince our board of directors that this was, a health-related field in which to invest, if you will, because individuals who are living in supportive housing, they have the option, of course, of seeking assistance, from healthcare providers, even that are in services that are provided there on site, and really being able to utilize those to improve their health and to help stabilize, their maybe life situation. So I think that is a really good recommendation. And then also, earlier in the webinar, Nancy had mentioned the number of years that individuals who are homeless, that their lives are reduced by because of living on the streets, and that to me was also a really difficult statistic to hear, if you will, and I think also proves the importance of housing and shows the impact on health. And so I really think and then utilizing the evidence base that it currently exists in supportive housing and how that has been seen to improve health. And there's actually a pretty nice write-up in the year one evaluation report that I cited earlier, and I can send the link to that to Lauren so she can share that with everyone. There's a nice in the introduction, a summary of a lot of the evidence base for supportive housing and the improvement in health associated with that was done by the Urban Institute, and I'm happy to share that as well to anybody interested.
Great, thank you so much. Jean, this is a question for you. So since launching, have you had any other funders, health funder or not, interested in making additional investments to expand or continue the Show Me Healthy Housing program?
We've had a couple of inquiries from some other funders who maybe haven't been currently investing in housing, and we're just beginning kind of to survey the landscape, if you will, and so I actually haven't been able to follow up with them as far as where they are now, but we have had a couple of inquiries, definitely, which is always exciting.
Great, thank you. And this is also a question for both of you. So understanding and appreciating how each program is different and also how each community is different, if we're interested in replicating a program like yours in our community, where do you suggest the best place to start is? And that might be kind of a long answer, but where do you think is the best place for Foundation to start if they're interested in a program like either one of these?
I think that it's a really good question. If I had to do it all over again, I actually would have started by doing sort of that local landscape. So it was pretty pretty interesting for us because essentially we work in 84 counties in the city of St. Louis, so really trying to it was hard to understand, what was going on in each of those respective counties. But I think, even just like locally in St. Louis, if we had kind of started a little earlier and talking with more housing funders here, then we could have, been kind of linked up with others in surrounding communities. And so even more kind of known more of those umbrella sort of organizations, if you will. I would also recommend talking with other kind of association groups, member association groups, like Funders Together in Homelessness, also like Grant Makers in Health, because they were very helpful to us, otherwise known as GIH. They were great in that they could send us a list of other foundations that are investing in housing and health, and so you could actually then, learn about their work and how it works within the community as well.
Yeah, I would definitely agree with all of that. I think looking around and seeing what resources are available both locally as well as nationally, there's a lot of people that are already doing this work. And I think that there are now beginning to be some good assessments that are being done so that people that are just starting into this can look and see what is similar to what work is being done that's similar to the work that needs to be done in their community, but also be able to compare communities of like size and like challenges and that kind of thing that can help you out. But I think there's so many resources that are available for you to kind of get started. And I think, pretty much there's no foundation that really operates in a vacuum or as an island. And I think that you could talk with the other funders in your area to see where their interests are and what would they be interested in learning more about and just starting to learn.
Great, thank you so much. Nancy, this is a question about the Innovation Initiative grants that you have. So after the pilots, do you continue to fund the grantees past that initial $1 million investment?
It depends. We have done so in two of the, how many have we done? 6 or 7 that we've done already. We have gone beyond that. In fact, one of the ones that initially started out as a really question mark, which is the Community Information Exchange, has grown to be our largest ever funded project at almost $4 million now. And we've had one other that we've done additional funding for. It really depends on the progress, what the challenges are, and how much we think that is really needed to perpetuate the work that they're doing. So we will go beyond the $1 million depending on them coming back and asking for more. And I'm always very involved with each of the projects, so I kind of know what their challenges are. I know what's coming up, and I work with the board based on what those challenges are.
Great, thank you. And here's another question for both of you. Have either of you had advocacy opportunities come about because of these programs, so such as Jean, with the report that the Urban Institute came out with, were you able to use that for any educational efforts or advocacy efforts? And Nancy, out of the innovation grants that you have given out, have you seen any advocacy opportunities come about from those?
Yeah, that's a great question. With regards to the Urban Institute, I'm not aware of directly of any groups that have been able to utilize that information. A lot of the year one information that was collected was sort of baseline, if you will, because it was at that time, I think only 2 of the 4 grantees had finished their housing. So we hope to have some more information, of course, about the tenants and the different apartments complexes, if you will, by the end of this year and certainly by next year. But we are also, at the foundation, we really do strive to be sort of a neutral, fact-based, providing fact-based information. And we have been working on kind of a policy brief about Medicaid and housing to be able to just, really show how some other states are utilizing Medicaid to help, particularly with the supportive housing services. And so that's something that, certainly groups would be able to utilize.
Great, thank you so much. So I think that's all that we have for questions right now, and we'll go ahead and we'll let people go a little bit early. I know it's lunchtime for some folks, but thank you again to our panelists, Nancy and Jean. We just really appreciate you sharing and enlightening us on these programs. And I believe that both of you said you're open to taking questions offline, whether that's through a phone call or email. So we'll be sharing information. And as I mentioned, we will have this webinar recorded and we'll make it available to members on the Funders Together website. I'll also be sending up a follow-up email with the link to the recording and any resources that were mentioned during this presentation. So again, thank you to our panelists and thank you so much for attending, and enjoy the rest of your week.
Thank you so much. Bye-bye.